Alzheimer's disease is a progressive neurological disorder that can cause brain cells to degenerate and die, right? So what are the main symptoms? Memory loss, progressive impairment in rational thinking, and behavioral impairment. Okay, what are the pathophysiology that we observe in Alzheimer patients, especially in the brains? So we see the neurofibrillary tangles. Neurofibrillary tangles are observed in the brain cells of the Alzheimer patients. So we have this neurotic plaque also, amyloid beta plaque, right? And also there is rapid loss of synapses and basal cholinergic neurons. Okay, this is the synapses, junction between two neurons. All right, one more important thing is there is something called this neurotransmitter present in the synaptic tube. So the level of this neurotransmitter also get reduced in the case of Alzheimer patients, right? So based on this particular observation, scientists in the 1970s, 60s, and 70s, they came up with a theory called cholinergic theory. Okay, according to this theory, what it says is, let's say this is the neurotransmitter. So when the neurotransmitter level is reduced at the synaptic cleft or the synaptic junction, we can see the symptoms that I've just talked about in the previous slide, right? The symptoms. Okay. So let's see what are these neurotransmitters. So one of the important neurotransmitter is the acetylcholine, right? So acetylcholine is transported to synaptic vesicles in the synaptic cleft. So it carries information from one neurons to another. So once the function of this carrying out the information is done, and once it is done, it is not broken down into choline and acetate, right? So this is the active form of the neurotransmitter, and now it is deactivated when it broken down into choline and acetate by an enzyme called acetylcholinesterase. Okay, so the idea is, if you blocked this particular enzyme function, right? So if you block this particular enzyme, then the neurotransmitter level of this acetylcholine, it will be maintained in the synaptic cleft. So when it is able to maintain the neurotransmitter level in a synaptic cleft, maybe we can see improvement in the symptoms that we have just talked in the previous slide, right? So exactly what this drug molecule does is the blocking of this function of this particular enzyme acetylcholinesterase. So donepezil is a drug molecule that is currently available in the market for the treatment of Alzheimer's disease. Okay, so it targets the particular enzyme called this acetylcholinesterase, and it blocks its function. So it inhibits its function, right? So this is an antagonist. Okay, so we can see uh, in the clinical trials, what we can see is donepezil, when given to Alzheimer patient, it can be used for, or it is used for alleviation. It is effective for alleviation of the symptom. It is not used for curing the disease. Okay, so but focuses on managing the symptoms. Okay, so this is the experimental or the X-ray structure of acetylcholinesterase. Okay, right, and this is the active site cavity where catalytic reaction happens. So, uh, so naturally, this is the substrate, right? The acetylcholine is the substrate. It comes and binds. When it comes to binds here, it's broken down into choline and acetate, and some of the important catalytic residues are this histidine 447, serine 203, right? These are the catalytic residue. So some catalytic reaction happens here, and then it breaks down the choline at the acetate. But when donepezils, when you give donepezil to the patients, it donepezil comes and sits in the active site pocket, so resulting in the blocking of this particular uh, acetylcholine. There is a substrate to come and bind at the active site pocket, right? So ultimately maintaining the level of this acetylcholine in the synaptic clay. So because of that, we can see the elevation of the symptoms in the Alzheimer patients. So why we are talking about this? So if you are uh, looking for substitute of this particular drug molecule, let's say this drug molecule is giving you a serious side effects, okay, in some cases. So I'm not saying that currently this drug molecule is giving you serious side effect. I'm just trying to give you an example. Okay, I'm just uh, giving a theoretical uh, theoretically, I'm just saying that this is giving you a serious side effect. So you would like to replace this, right? But if you want to maintain this particular, you know, uh, some kind of interaction is there, so some kind of binding affinity will be there, right? So when we calculate the binding affinity of this enzyme, this drug molecule against this particular target. When you do experimental study, let's say if you have IC50 value, let's say 30 nanomolar or something. So I would be looking for molecules which could give me similar kind of this binding affinity, but with less toxicity, right? So you can do experimental study. You can go for in vitro, in vivo studies, but then you have to look for large databases or large libraries of molecules, small molecules, right? Similar to this drug molecule. So if you have like millions of molecules doing experimental study for binding affinity, it will, you know, will take time, and your resource also will be, you know, uh, you should have a very rich, okay,